Dylan is a 12-year-old boy that was diagnosed with OJIA at 4 years old. He is now 12 and has felt an increase of stiffness and pain in his joints. Dylan has arthritis in his patella, phalanges, cubitus, and his eyes. Dylan's goals were to get back to swimming, gaming, and playing soccer without any joint or muscle pain. We are here to help him with that.
Dylan should be in physical therapy for 6 to 8 weeks to start with until he gets better or shows some progress. He will have sessions once a week doing more in-depth exercises while in the office, but on the days that he doesn't have physical therapy, he will do easier at-home workouts, focusing on maintaining progress. The long-term expectations for Dylan are to reduce his pain as much as possible so he can go back to living a normal life. Short-term expectations are to maintain any progress he makes. He should also see an occupational therapist once every other week to avoid his eyes from getting worse. Dylan will see his pediatric rheumatologist every 2 weeks until the progress is seen. One exercise Dylan can do is finger bending. This is when you hold your hands out with phalanges slowly bending. Your phalanges move with anteriorly, then bending posteriorly, then bending back. Knee extensions as well, which is sitting upright in a chair with your feet flat on the floor, extending the leg anteriorly by straightening the patella joint, then pulling back to original position. And another is the elbow flexion and extension. Sit with your arms by your side, slowly bend your elbows by moving the anteriorly during the flexion and posteriorly during the extension.
The condition involves the orbital region, specifically inflammation within the articulations surrounding the sphenoid bone, the frontal bone, and the zygomatic bone of the skull, located superior and anterior on the body. In the upper extremities, arthritis is present at the elbows, involving the articulation between the humerus, which is proximal, and the ulna and radius, which are distal. These joints are located distal to the shoulder and proximal to the wrist.
The manual region shows involvement of the fingers, specifically at joints between the metacarpal bones and the phalanges, positioned distal to the carpals and lateral to the midline in anatomical position. In the lower extremities, arthritis affects the knees, involving the articulation between the femur, the tibia, and the patella. These structures are inferior to the pelvic region and proximal to the ankle joint.